Thank you, guys. We'll take a couple minutes just to describe what we're doing here. I also have ties from CHOP. I trained with Nancy Spinner and Ian Krantz and David, and I think my heart is always tied to Alagille Syndrome, so I keep coming back. But now I'm at Children's Hospital Los Angeles, and I work with Gage and Bee. And this study was sort of inspired by Gage because he really studies development and basic science in biology of facial development. And he has some great animal models that we could test a lot of these hypotheses and actually discover new things in these models and see how we could help patients in the long term. So he has some models in zebrafish and mouse models, and he's going to give a talk a little bit more detail later on in the second session in the afternoon. But it talks about evolution and fish biology and how the jaw in the fish actually evolves into the middle ear bones in your ear. And so I'll show a couple quick pictures, but the question is, if you have a genetic change in the JAG1 gene and there's a potential middle ear defect in the bones, can there be hearing loss? And in fact, we know that everybody can hear pretty well, almost similar to everybody could see pretty well. But most of us, a lot of us have glasses, and if you take off your glasses, you probably can't see the board. And so, I'm not technically blind, but I won't be able to do as well in school if I can't see the screen very well. And so the question is, if there's some mild hearing loss, maybe there's a way to help those kids a little bit more and amplify them. And we did come to a meeting last time, and we tested several families, and I'll show some of those results. But this is some of the pictures that Gage will describe later. And the question is, we tested it in zebrafish and in mice, but similar to the CHOP studies, is really the most important question is, how does it influence humans? And so we come here asking, is hearing loss, do kids have hearing loss or adults have hearing loss? And how common is it? Should there be additional recommendations? And should it be monitored or treated? And then once we do a hearing test, we'd probably recommend somehow imaging the bones in your middle ear with a CAT scan. And a couple people have followed up with that since the last study that we did 3 years ago. So what we're going to do here is Bee's here. She's an audiologist, and she'll be conducting a hearing test. And she could describe that in a second. We'll also get a saliva sample just to get some DNA, just to confirm the genetic change in Alagille syndrome. And also, if you do have hearing loss, test the hearing loss genes just to make sure there's no confounding factors, or maybe there's a modifier of that effect. And we would also recommend a CAT scan if you do have some hearing loss. And the nicest thing is that Gage and I have applied for funding, and we do have some funds from the March of Dimes to complete some of the animal studies and to actually bring some people to Los Angeles if you don't have a local person that's advocating for you to get the appropriate care for your hearing and the scans. So if you're local or you're just passing through Los Angeles, we'd love to see you. And these are some of the tests we did last time, and B can just describe what we could see here. This is actually not caused by Alagille syndrome, but this is from noise-induced hearing loss from someone who actually was listening to loud music during their teens. So, And so it's a complicated little chart that we'll be drawing, but we're going to not only do the test, but explain the results to you sort of in a confidential manner. Last time we tested 19 subjects. We have 22 people tested. Half were normal, half were abnormal. And so, it's a subtle change, but we're really trying to figure out the influences of Alagille syndrome and hearing loss. We're looking for conductive hearing loss. And so when you hear conductive hearing loss, people say, oh, that's because of fluid, and maybe that'll go away. And so we do two parts to the test. There's a tympanic membrane test where we look for the movement of the eardrum. And if it's conductive and it's not moving, maybe that's true, it's fluid, we'd want to repeat that. And if there's no fluid there, then it actually might be a middle ear bone defect. There's also other middle ear and inner ear differences that kids with Alagille syndrome have, and we could study that and learn from that as well. But the more people that participate, the quicker we can actually give you more confident results and get this out in the literature so that more people will be able to learn. And so that's pretty much the slides that I have. B will describe the quick process.
So mine's a little bit less intimidating. So for my testing, what I'm going to do is I'm going to look in your ears, check out your eardrum to see if that's healthy. I'm going to put a little rubber tube or a little rubber piece in your ear, and what that's going to do is put a little puff of air, which you won't even feel, into your ear and wiggle your eardrum. That air is just going to push against your eardrum, and I want to see your eardrum push back. Not going to feel it, you're just going to hear a little hum. After that, then we'll do the actual hearing test. We'll put some headphones on. If you're a tiny little person, we're going to play a game. If you're not a tiny little person, you're going to raise your hand for me when you hear a sound. And basically, the whole point of this is we all hear in here. We know that. But even a mild hearing loss can, and I'm seeing faces that I've tested before. I've tested you. Even with a mild hearing loss, there can still be a huge educational impact. So with a mild hearing loss, you can be not hearing up to a third of the speech sounds, which doesn't seem like a ton, but then you put a kid in a noisy classroom with chairs scooching and teachers moving around the room and teachers talking at the board like this so you can't see their lips move. You're missing about half the speech sounds. So even a mild loss can have a huge educational impact. I think your lives are already hard enough, and my job is to make your life easier. So the more information we have about hearing and hearing loss related to Alagille, the better we can serve you to help increase your quality of life a little bit. So if there's anybody that you think is going to be a little skittish to this, I would love to do my testing before any other testing because I need a lot of patient participation. So if you think someone's going to be a little scared to do some things, hit me up first. So I have a really, really ready to go kind of kiddo. Right.
The other part is that we'll be here all day today and tomorrow. There's sign-up sheets outside with times. You know, if people are busy, you could just give me your number and we could call you when there's a break, or we'll do it late or early in the morning tomorrow. We'll be here all day today and tomorrow. Oh, and if your kid's really young, like last time we tried to test really young children, they may not be cooperative, so we're trying to get kids that are 3 years and older. And if you had your testing done before, we're happy to retest it again. And if you don't have Alagille syndrome and you want your hearing tested, we could also do that as well, just, you know.
Here to serve, people.
You know, I just mentioned at 4:30 I'll be giving a much more detailed talk, including the middle ear loss, but just in general about facial development. We have new zebrafish and mouse models of some aspects of Alagille syndrome, so for those who are interested, at 4:30 in one of the breakout sessions.
And if you've had it tested outside, we'd love to get those results. If you had a CT scan outside, we'd love to look at those as well. The more scans, the better it's going to be for us.
Maybe just a follow-up on that is, at USC where we're at, we actually have an expert, John Go, who is an expert in the temporal bone and specifically in the middle ear bones. And so he's a really good resource to, because these middle ear bones are the tiniest bones in your body, so it can actually be very difficult to really, you have to have an expert who can really identify the shapes in these scans.
Yeah, on that note, you know, one scan was sent to us that was read as normal. I took it to a neuroradiologist, and they said, you know, I think I see some things, but when I showed it to John, he only focuses on the temporal bone, and he clearly defined all the anatomy, which was very helpful. So, you know, just if you're interested, we'd really appreciate your help. Thank you.